Hi, my name's Tia. I'm going to be answering some of your questions today.
I'm Tessa. It's nice to meet you.
So I heard you're in here. You have some questions about Crohn's disease?
Yeah, my dad was actually recently diagnosed, and I wanted to know what that really meant and if I have a risk of getting it.
So do you know what Crohn's disease is?
Kind of, not really. I know it has something to do with your intestines and can cause a lot of pain, but no.
Yeah, so Crohn's disease is a disorder of your digestive system where your immune system is actually abnormally attacking itself. So your immune system essentially attacks your intestines. So that's what's going on with your dad. The most common part of the intestine that's infected is the ileum, which is the lowest part of the small intestine. So I don't really know what part of the intestine is bothering your dad, but that's the most common. And when the intestines get inflamed, it actually causes them to become thick and swollen, which is what causes the pain and discomfort. And if it's not treated, there can also be ulcers that can tear when food is passing through your digestive tracts, causing you to bleed.
That sounds good. Yeah, my dad actually noticed that there was blood in his stool, so that's why he went to the doctor. Is that one of the symptoms?
Yeah, so blood in the stool is actually one of the more common symptoms. The symptoms start with having diarrhea and abdominal cramps, and a lot of people don't realize that they have Crohn's at that time because diarrhea and cramps are so common with many other things, like just eating something that didn't agree with you or not getting enough sleep. Really anything can cause diarrhea or cramps, and so a lot of people don't even realize they have Crohn's until they start experiencing that bleeding, and they get alarmed and go to the doctors and find out that they have Crohn's.
So is it life-threatening or it's not? Is that what I'm hearing?
Not when it's treated properly. It can be dangerous if you lose too much blood with that bleeding. It can cause anemia, low vitamin B12, and low iron just from that blood loss. But if you're getting treated, and besides the pain and discomfort that can be difficult to live everyday life with if you're having that pain so often, it's not really life-threatening unless you develop those complications.
Okay, well that's good. I'm glad that my dad will be okay because he has the disease. So is it possible that I may also have it?
It is possible. Crohn's disease does have some genetic ties. Do you know a little bit about DNA?
Biology in high school.
So your DNA is actually read in 3 letters, and a variant in your DNA occurs when a letter is missing or it's misread. And that's most likely what has happened with Crohn's disease. So they don't really know 100% of how the inheritance pattern of Crohn's works, but there's certain genes related to the disease, including ATG16L1 and just a bunch of other genes that are a little more deep than we have to get into today.
Mm-hmm.
But with those genes, a variant occurs where something's missing or misread, and that's what causes the attack of the immune system. There's also environmental and lifestyle factors as well that can influence Crohn's, so it's not just completely genetic. Smokers have a higher risk of developing Crohn's later on in life, or certain things like diet. Like if you have diets too high in sugars or fats and you have Crohn's, that can increase your flare-ups. But studies actually show that children who have one parent who's diagnosed with Crohn's only have a 7 to 9% chance of inheriting the disease genetically. So
it's not bad at all.
Yeah.
So if they don't know a lot about it, does that mean that they can't really tell if I have it or not? Or how do they know if I...
Well, if you were experiencing any of the symptoms, like if you have had any diarrhea or abdominal cramping, or if you've noticed any bleeding, or if you're really just concerned at all, you could schedule a colonoscopy where the doctor would be able to get a closer look at what's going on in your intestines.
Okay, and what's a colonoscopy exactly?
So a colonoscopy is a procedure where you drink this stuff called Go Lightly, and it is like fluids that help clear out your intestines. When you go in for the procedure, they'll actually insert a small camera attached to a tube up your rectum while you're sedated, and it will just travel up your whole digestive tract and take pictures along the way, so they'll be able to see if there's that inflammation and swelling. Because I actually have a picture here.
Good. Reference
that I can give you, where you see the difference between a normal intestine and a Crohn's intestine. So there's a lot of fat that develops, and the intestine becomes really thickened, and they can cause fissures, which are little cuts in your intestine, which can cause bleeding, and also ulcers. So if they are traveling up your intestine with the colonoscopy, they'll actually see something similar to this, and they'll be able to do some more testing or just diagnose you with Crohn's and get you on the right treatment path.
Okay. Well, I'm not experiencing any symptoms, but it's good to know that I'll have to do that if I feel like I have it.
Yeah, exactly. So do you have any questions about your dad and what happens next now that he's diagnosed, or?
Yes, I know that there is no cure for the disease. My dad told me that, but what are there for treatments that they have so far?
Yeah, so unfortunately Crohn's, there is no cure, as you have said, but there are treatments. Treatment is really different for everybody. It's a matter of finding out what regimens work for your dad. So there's anti-inflammatory and corticosteroid medications that can help reduce the inflammation. So your dad will continue to try different regimens until he finds the one that has the least amount of side effects, and it seems to control his pain and discomfort as well as possible. And because of the bleeding that he's also experienced, he may benefit from getting iron supplements or a B12 vitamin shot, which just those deficiencies can cause like tiredness and weakness. So it would help just replenish the stuff he'd lost from bleeding. And if necessary down the road, if it gets really bad, they can actually do surgery and remove that part of the intestine. But that still is not a cure because the disease can occur somewhere else in the intestine in the future. So,
okay, so that's a lot of information to process.
Yeah, how are you feeling? Do you have any more questions or anything?
I mean, I'm slightly overwhelmed, but I feel better knowing what it is.
Yeah, so what's your usual coping mechanisms? Have you ever gone through like a difficult situation like this, and how do you usually react to this sort of information?
I like to talk about how I'm feeling, and I can sometimes get a little emotional about things. But
have you been talking to your dad at all about what he's been diagnosed with?
Yeah, I have. It's a little scary because I know he doesn't eat nuts because nuts make him have blood in his digestive tract, I guess. But it's just definitely scary to not know what the treatment is.
Yeah. So how do you think you can use those coping mechanisms to talk to your dad and kind of work through the situation?
It makes me feel better that he's not scared and that he knows what's up and that doctors are doing all that they're doing and that he knows what his regimen is, like you explained, and what works for him. And I want to be there for him for whatever he decides to do in the future, if it gets worse or better. And I thank you so much for helping me out and answering all my questions about it.
Yeah. Do you have any concerns about yourself in your possibly getting diagnosed with Crohn's, or just the idea of not really knowing?
I mean, it's definitely scary. I'll definitely keep track of and watching out for any of that symptoms, but it's good to know, and thank you so much for your time and explaining all this to me. It reassures me a lot more.
Yeah, and if you have any more questions, you can definitely feel free to contact us and talk to your dad's doctor for sure as well. One thing I did want to mention was to just make sure, it sounds like you and your dad have a good relationship and that you're going to be there for him throughout this diagnosis and whatever happens later on down the road, but it's important that the decisions that he makes with his treatment are his decisions, and it's good that you're there to support him along the way and really help him, and you should give your opinions on what you think should be done, but the ultimate choice about his treatment should be his own.
Yeah. Oh, don't worry.
Is that okay with you?
Yeah, that's good. I understand.
You guys have had that discussion?
Yes, we have.
Yeah, so
clarifying.
the last note I just want to leave you with is I do have this brochure here from the Crohn's and Colitis Foundation. And I'm actually going to print one off and send it home with you. It has a little bit information on a little bit more of what we've discussed today about what Crohn's disease is, who gets the disease, the genetics of it, and treatment, and where you can find support and
All right, that's awesome. I will.
any further, because they're always doing clinical trials and other new stuff is coming available. So who knows? Maybe they will have a treatment someday, and you maybe down the road will have more questions. So
All right, well,
we'll provide you with that so you can get some answers.
sounds great. Thank you very much.
Awesome. Yes, it was nice meeting you. Good luck.
Thank you.
Thank you.